Good evening, everyone, and welcome to this wonderful evening. I'm very sure you're all laboring a great way with the exam in a very short period of time. Now, during this revision time, there is a very little time for the long explanations. Everything is about a condensed revision. So, Incus learning app, 3 minutes. We drive around 10 points. Every 3 minutes, there's a short video. And you can be able to swipe, and then be able to do the revision, bookmark those videos for the last moment revision. Now let us create a great revision notes for the upcoming NEET PG exam. So let's make the great start. There are certain blood vessels which bleed. So you should know very well what are those blood vessels. Interdural hemorrhage. Typically it is because of the middle laryngeal artery bleeding. Subdural hemorrhage in an elderly person with a shrunken brain without any trauma history also, even if you shake him, that can lead to the injury to the bridging diploic veins, and that leads to subdural hemorrhage. Subarachnoid hemorrhage is because of the rupture of the congenital berry aneurysm, typically in the anterior communicating artery. Whenever tennis ball injury is there, one of the common questions of the examiner is, what is the blood vessel which is involved? It is circulus iridis major which is involved. Circulus iridis major which is involved. And whenever there is an epistaxis, then it is the submucous venous plexus, sphenopalatine artery which is involved in epistaxis. And during tonsillectomy, it is the paratonsillar veins and the tonsillar and ascending palatine vessels, which are the source of the bleeding, is what you have to emphatically remember. Now, whenever there is any hemoptysis or whenever there is any bronchiectasis, you get bleeding. One of the commonest questions asked by the examiner is, what is the source of bleeding? It is the bronchial artery which is considered to be the source of bleeding. Gastric ulcer, whenever there is any bleeding in gastric ulcer, it is the left gastric artery and the splenic artery which is the source. Whereas for the duodenal ulcer, whenever it bleeds, it is the gastroduodenal artery which is the source. Hemorrhoids can bleed. It is the submucous venous plexus which is the source of the bleeding. Whenever retropubic prostatectomy is done, it is the dorsal venous plexus which undergoes the bleeding. Then submucous venous plexus responsible for the hemorrhoidal bleeding. It is the superior rectal vein and inferior rectal vein together form the submucous venous plexus, which is the source of the bleeding of the hemorrhoids, is what you need to basically remember. Hysterectomy, it is the internal iliac artery which is the source of bleeding. And when there is a menstruation, it is the spiral arteries in the endometrium that undergoes the bleeding, is what you have to emphatically remember for the tomorrow's NEET PG exam. Now, the next very important and interesting question is about end arteries. Where are all the end arteries located? So let us become the champion in this topic. The central artery of the retina, it is an absolute end artery. central branches of the cerebral artery, vasa recta of the mesenteric artery, artery of the spleen, artery of the liver, kidneys, lungs, and metaphysis of the long bones. They're all considered to be the end arteries, is what I want to underscore to all of you. Then another very interesting question asked by the examiner is, one of the favorite question is, different types of capillaries. What are the different types of capillaries? Where are they located? You have to make one list and keep it ready for the tomorrow's vivavos and the examiner's question. So let us look into the various types of capillaries. Capillaries can be continuous capillaries, where the endothelial cells provide an uninterrupted lining and only allow the small molecules like water and ions to diffuse through the tight junctions. Then tight junctions in turn can be divided into two subtypes. Those with numerous transport vesicles, you find them in the skeletal muscles, fingers, gonads, and skin. And those which have few vesicles, and they are found in the CNS. And the blood-brain barrier, you have this kind of second type of tight junctions. That's what you need to remember. Then fenestrated capillaries. What is the story about it? Fenestrated capillaries have pores in the endothelial cells, and that will allow the small molecules and the small molecular structured proteins to diffuse. So the renal glomerulus, vasa recta of the renal medulla, endocrine glands, similarly pancreas, intestinal villi, and the renal glomeruli are the classical location of the fenestrated capillaries, is what you need to remember. Then you have the third type, which is called sinusoidal capillaries. They're a very special type of fenestrated capillaries. They have large openings in the endothelium. They're highly permeable. So where do you find this kind of sinusoidal capillaries? It is a favorite MCQ of the examiner. Liver, lymphoid tissue, endocrine organs, hemopoietic organs like the bone marrow, spleen, not in the skeletal muscle. And these sinusoidal capillaries, they can connect an arteriole with the venule. For example, if you take spleen or bone marrow, or they may connect a venule with another venule, as in the case of the liver, is what you need to emphatically remember. Now, there are certain areas which are called the danger areas. In various parts of the body, you have these danger areas. One of the favorite MCQ. So all these 3-minute videos on the Incus learning app, be very sure to bookmark them. In the Incus app, you have a place called bookmark the short videos. So bookmark them and you try to revise in the last moment before exam. So that's what I wanted to tell you. All the learning on the Incus learning app is absolutely free. You too can upload a lot of videos while doing the revision for the exam. Ultimately, let us all study together every day and become a topper in the tomorrow's NEET PG, USMLE, MBBS exam, FMG, anything you say. It is a student to student, student to teacher, teacher to student video review. 3-minute videos, just like TikTok. You can click the button and can upload the video. Click the button and upload the video. So don't forget to download the Incus learning app. So doctor, now, what are the various dangerous danger areas. Let us be very sure. The danger area of the scalp, it is the layer of the loose areolar tissue of the scalp. Because the emissary veins open here and they transmit infection to the various venous sinuses. Similarly, in the eye, ciliary body, which is the part of the uveal tract. So what is uveal tract? I, C, C, U. I is iris, C is ciliary body, C is choroid, is the uveal tract. So ciliary body, whenever it injures, it will initiate a sympathetic ophthalmitis. That's the reason called the dangerous area of the eye. The dangerous area of the nose is the olfactory area. The dangerous area of the face is the lower part of the nose and the upper lip. Because directly there is a connection to the cavernous sinus, to the facial vein, and its communication, superior ophthalmic vein and the deep facial vein. So that is the reason, dangerous area of the face, superior ophthalmic vein, deep facial vein, cavernous sinus, lower part of the nose, upper part of the lip. That is how you have to remember for the tomorrow's exam. Now, doctor, different types of cartilages. This is another 3-minute video on the Incus, kind of a short topic for the tomorrow's NEET PG. Definitely one question is going to come on different types of cartilage. So there are about 10,000 important lists that you need to remember. You need to keep in your pocket when you go for the tomorrow's NEET PG exam. These 10,000 areas into 3-minute videos. Totally around 30,000 minutes. These 10,000 small areas, everyone should be able to remember, reproduce, revise in the tomorrow's exam. Right? So I'm going to make it all 3-minute videos, upload it into the Incus learning app. You also, while studying, make a little notes, upload a 3-minute video. You see the fun. People will like you, share it, become your fans, follow you, connect with you, chat with you, and you will form a very good study partner group. So Incus platform, Incus learning app is such a kind of a platform which will enable a lot of user-generated upload of the content and study together, student to student review. Now let us become the champions in cartilages. So doctor, hyaline cartilage. It is most abundant cartilage of all the 3 types of cartilage is what you need to remember. And all cartilaginous bone is preformed in the hyaline cartilage. It calcifies after 40 years. So what are the examples of the hyaline cartilage? This is a favorite and important MCQ in the tomorrow's exam. Embryonic epiphyseal plate, articular cartilage, arachnoid cartilage, thyroid cartilage, costal cartilage, tracheal cartilage, bronchial cartilage, cartilage of the nose, cartilage of the larynx. You can remember blanket, right? So K is costal, E is embryonic epiphyseal plate, then A is articular arachnoid, T is thyroid, tracheal, bronchial, N is nose cartilage, L is larynx cartilage. You should not forget, blanket is an easy way for you to remember the hyaline cartilage. Then what is fibrocartilage? All menisci, intervertebral disc, intra-articular disc and labrum. the glenoid labrum at the shoulder, acetabular labrum at the hip joints, symphysis, acromioclavicular joint. You remember with the mnemonic milia. Milia. M is menisci. I is intervertebral disc. I is intra-articular disc. Labrum. Like glenoid labrum at the shoulder and acetabular labrum at the hip joint. And symphysis. Acromioclavicular joint. So milia is something that you can remember for the fibrocartilage. Can the online students can quickly punch whether the voice is loud and clear without any breaks? Please punch. Is the voice is loud and clear for all of you, doctor? Now, the third type of cartilage you need to remember is elastic cartilage. The cartilage in the auricle, external ear, external-acoustic meatus, eustachian tube, inlet of the larynx, corniculate, cuneiform cartilage, epiglottis, they're all elastic cartilages is what you have ultimately remember. So, this video, 3-minute video on 3 types of cartilage: elastic cartilage, fibrocartilage, and the hyaline cartilage. You have to emphatically remember. After this session is over, we will upload this video. We will remove it from YouTube, upload it as 3-minute videos into the Incus learning app. So download the Incus learning app, bookmark those videos, go to your dashboard or the Incus learning app. All these bookmarked videos will come to one place. Right, doctor? Now, what are the peculiarities of clavicle? This is one of the famous MCQ. Clavicle, no medullary cavity. It is the only long bone horizontally staying. It is the first long bone to undergo ossification, and it ossifies by 2 primary centers. And the only long bone to have a membranous ossification. Right? So, this 3 minutes video on clavicle, peculiarities of clavicle in anatomy, bookmark it on the Incus learning app, 3-minute video, right? So there is a plan. Now comes the most nagging topic: types of joints. Hinge joint, condyloid joint, where do you find? Favorite question of the examiner. So last moment preparation is all about, there are 10,000 3-minute videos I'm going to prepare, upload it into the Incus learning app. Free, absolutely free, no worries. Only thing is, download the Incus learning app, keep bookmarking those videos and push it into your bookmark stack, and then do the revision for the last moment preparation, right? So that is going to be the plan. So doctor, the types of joints is a favorite question of the examiner. Hinge joint, here only flexion and extension is possible. Elbow joint, ankle joint, interphalangeal joint, elbow, ankle, interphalangeal, hinge joint. Ellipsoid joint, it is found in the wrist. All metacarpophalangeal joints are all ellipsoid, interphalangeal or hinge. Atlanto-occipital is ellipsoid, but atlanto-axial is pivot. This is one of the favorite MCQ in the exam. Similarly, superior and inferior radio-ulnar joint is also pivot. Then condylar, or bicondylar joint, knee and temporomandibular joint of the jaw. Saddle joint, you are horse riding, saddle joint. Thumb, that is the first carpometacarpal joint is saddle. Sternoclavicular, calcaneocuboidal, incudomalleus, they're all saddle. Then ball and socket, everybody remember, there is no big deal about it. The shoulder joint, hip joint, talocalcaneonavicular joint, incudostapedial joint, they're all ball and socket joint is what you need to basically remember. Now, doctor, the next question is the different types of joints. If you look at the fibrous joints, typically the sutural joints, which is peculiar to skull. Syndesmosis, where the bones are connected by interosseous ligament. A very good example is the distal tibiofibular joint, foot plate of the stapes with the oval window, that is a tympanostapedial syndesmosis. You need to remember, a fibrous joint. Similarly, gomphosis, that is peg and socket joint. The tooth in the socket, dentato-alveolar joint is an example of gomphosis, is what you have to emphatically remember. Then what are the various cartilaginous joints? Whenever the joint is surrounded by a fibrous capsule, which is lined by a synovial membrane, and it is classified according to the cartilages which are covering the articular surface. So cartilaginous joint can be a primary cartilaginous or secondary cartilaginous. Primary cartilaginous is also called synchondrosis or hyaline cartilage joint. Secondary is symphysis or a fibrocartilaginous joint. So any growth plate between epiphysis and diaphysis. Diaphysis means shaft. Epiphysis is the growing end. Between epiphysis and diaphysis of the long bones, spheno-occipital joint, first chondrosternal, costochondral joint, they're all primary joints. Then, symphysis pubis, manubro-sternal joint, intervertebral joint, sacrococcygeal joint, they're all examples of secondary cartilaginous joints is what I want to underscore to all of you. Now, doctor, one of the favorite areas of the examiner, the vagus has got beautiful branches, external laryngeal, internal laryngeal. So what are the branches of the vagus? What are the various muscles supplied? What is the exception? This is the favorite 3-minute video banenge about this very, very important thing that you need to remember for the last moment revision before the exam. Now, there is a external laryngeal nerve and a internal laryngeal nerve. External laryngeal supplies the cricothyroid and it accompanies superior thyroid artery. Please don't forget. Internal laryngeal is sensory to the laryngeal mucosa above the level of the vocal cords. And the internal laryngeal pierces the thyrohyoid membrane. That is what you need to remember. Then, right recurrent laryngeal nerve. All intrinsic muscles of the larynx are all supplied by the recurrent laryngeal nerve, except the cricothyroid, So all the sensory supply above the vocal cord is by interlaryngeal nerve. So all the sensory supply below the vocal cord is by the recurrent laryngeal nerve. The right recurrent laryngeal nerve branches to deep cardiac plexus, trachea, esophagus, and inferior constrictor. And the right recurrent laryngeal nerve arises from the vagus and it is in relation to right subclavian artery. It hooks around it and then it ascends up. So suppose if this is the artery, it hooks around the right subclavian artery and ascends up. That is the story of right side recurrent laryngeal nerve. Then how about left side recurrent laryngeal nerve? The left recurrent laryngeal nerve, all intrinsic muscles of the larynx except cricothyroid, sensory below the vocal cord, and it goes to trachea, esophagus, inferior constrictor, and deep cardiac plexus, just like right recurrent laryngeal nerve. Even left recurrent laryngeal nerve arises from the vagus in the mediastinum. And where does it arise? Aortic arch. It loops around the aortic arch and ascends into the neck. Whereas the right recurrent laryngeal nerve loops around right subclavian artery. That is the difference between the right and left recurrent laryngeal nerve is what you have to emphatically remember. So, doctor, with this, we conclude in today's evening, and I keep posting more and more videos. So just download the Incus learning app, and whenever I get time, I keep coming online and then start a session. So that's the reason, click on the notifications so that YouTube will send you the notifications. Thank you.